Hi everyone, I'm Dr. Joseph Cipriano here at Palmetto Physical Medicine in Greenville. We have our patient. She was having the upper back pain. She's now in again for another visit. So I know that you are still having issues, but for the time being, I know you're just telling me it was better. Just one adjustment is never just going to fix anything chiropractic. It's something that we do multiple times because we need the body to start to hold those adjustments longer and longer. So how are you feeling today?
Today, it's not as bad.
Okay.
Yes, last night was bad. Yesterday afternoon, and then like getting up and moving around after work sort of helped, but it's still all through my cervical and thoracic spine as well.
All through and right through in here?
Yeah.
Okay. So majority of the issues are going to be coming right through here. So what I'm going to have you first do, I will have you lay face down for me, okay? All right. So when I have the patient lay down, the first thing that I like to do is I want to come to the feet, and I'm going to check the leg length out. So when I push the feet up, come over. Her right leg is a little short. We can bend the legs out, bring it back. Okay. So these are things that I like to look at when I'm checking and observing everything. Also, one thing that I scan the entire body, looking all the way up, and I like to see exactly what's going on. If there's any tilting, any issues like that, that's what I go for, and that's what I'm looking at. So now when I go to palpate the spine, I'm feeling it, and what I'm looking for like tight muscles, anything, if things are tight or if the symmetry isn't the same on either side. So what I'm doing, I'll go up the spine, I'll start in the lumbar, come up through the thoracic spine here, and then make our way to the cervical spine. So actually, yeah, right in the area where she's telling me and where she's having her main complaints, yeah, I can tell both sides, everything is actually just really tight, quite locked up. Your traps going through here are also very tight. So yeah, these are going to be the main complaints. Now we're going to check the neck as well. Get a little bit more tightness here on her left side. So these are issues that, when she goes to come in, she is always going to tell me and let me know tightness through here, and then I like to confirm things, also checking and seeing exactly as what's going on. So as I like to start, we're going to start with the upper thoracic, that T1, the cervical thoracic junction. So it's really inflamed here on the left side, so we're going to get some good movement in. There we go. That was moving before I even did anything. Okay. And we're going to go a little bit lower here on the right. So from T2, we're going to go from the right. Perfect. Got great movement there as well. Good. That just opens up quite a bit right through that cervical thoracic junction. Typically what I'll go through now is I like to go through the thoracic spine, and we'll get a little movement. So I do the thoracic spine a few different ways. She is in the prone position, which means face down. There's a prone position to do the adjustments. There's supine, which means face up. And then there's also a standing thoracic. So there's 3 different ways at times that I will do adjustments on the patient. Just everyone, they respond differently to different adjustments. Some patients actually respond and they move very easily with some ways, and others, don't. But that's why as a chiropractor, you learn different ways and different techniques to make things move. So we're going to go right through the thoracic here. That actually moved quite a bit there. Yeah, I know you felt that one. Okay. And then we'll come down into the lumbar spine as well. So it's a little tightness on either side. What I'm going to do, typically, I don't use instruments as much, but today I will use it. This is called an arthrostem. It does an adjustment with I use the 2-prong on it. And what I'm going to be doing, we're just going to be going down just the muscles right on either side of the spine here. So we'll come in with the arthrostem. And literally what I'm doing, if you can tell, so depending on the angle and how I'm using the arthrostem, and depending on the pressure on which I put down with the arthrostem is going to depend on the type of adjustment. So some patients, you know, they all, like I say, they all respond differently to the different adjustments. So in her case, I'm really trying to hit the muscles on either side of the spine here. But then what I'm going to have you do is I'm going to have you turn on your side and face me this way. So you're going to raise this headpiece up. Good. That, perfect. Good, there we go. Turn to the other side for me. Good. Perfect. And then with this, I just roll her over and perfect. Got good movement. She moved a lot better on this side compared to the other, but both ways did get great movement. Yeah, let me just push this headpiece down. There we go. Have your legs flat for me. So in here, typically like to get a leg pull in. What the leg pull is going to do, she's going to feel movement going into the knee, going into the hips, and then also going into the low back. The reason that she feels from a pull all the way down here in her low back is that your psoas is the only muscle that attaches to the lumbar spine and attaches also all the way to the femur. So she may be feeling this all the way in that part of her spine. Good. And then from here, this is where I like to do the cervical adjustment. So when I go through, I'm palpating either side. I'm seeing the muscle tonicity on either side is what I'm feeling for. Kind of like to get a little movement in here, see how she's moving. A little bit stiffer and tighter on the lower cervical spine from about C5, C6, C7. Those ones aren't moving as good. So we can just start off. Perfect. There we go. That just moved really well. Okay. And just a little one with that, but that just realigned everything. Okay. So I'm going to have you scoot down for me. Good. So what we're going to do here, we're going to do the Y-axis distraction, and then the reason that I love doing this technique here is it's going to take pressure all the way up from the cervical spine, going all the way down into the sacrum. Like I always tell everybody, every day you've got gravity just pushing down on you, and what this is doing, this is opening up and taking pressure off all of these nerves all the way down. So when you take the pressure off the nerves, that gives them the ability to heal and function as it should. So you want to pull your hair through? Good. I'm going to have you lay back for me. Perfect. And then this is where I come up to the head of the table. I'm going to make sure that the strap isn't covering the ears. And I give the traction out. And how was that?
It's good.
See, I remember the first time, or the first couple times doing that, it was just like, it was actually quite a great move, but yeah. So I know that just takes a lot of pressure off. I know you felt that going all the way down. I just want to check one more thing before we finish. I want to check because this was her main complaint really right through the thoracic, which it has loosened up, but what I'm going to have you do, I want you to stand up for me. I want you to face the wall that way. So I want to just make sure. Put your arms out. Your hands are over mine. I'm going to have you lean back, bring your elbows together for me. Here we go. See, that was the last little bit that wasn't moving from before, and that just really got that last little bit moving great. So let me know how that goes after today. I know obviously you'll be back in, you follow your care plan very well. So can't wait to see you again, and then let all the viewers know next time how you are feeling from there, okay?
Deal.
Perfect. So I'm Dr. Joseph Cipriano out here in Greenville at Palmetto Physical Medicine. Honestly, every week I've been getting more and more people that are viewers of mine coming in. I love that. Anyone who is interested in getting adjusted, I'll have all the information listed here on the bottom of the page. Email, call, and we'll get you signed up and scheduled in. Have a good one, guys.